panicking. Relax. UK has not stopped recruiting health and social care workers from Nigeria, Ghana, Zimbabwe, and other African countries. People, welcome back to my channel. My name is Eniola Adeniro. If you see my video for the first time, thank you so much. And if you are a returning subscriber, thank you so much for your loyalty. Today we're going to be discussing the code of practice for international recruitment of health and social care personnel in England, and this would answer your question: is UK still recruiting health and social care workers from Nigeria, Ghana, Zimbabwe, and other African countries? This is going to answer your question. So without wasting so much time, let's get started. And before we dig in, please make sure you like this video, subscribe to my channel, and share this video. Thank you so much. Let's get started. I've gotten several calls from Nigeria that asking whether the UK government have stopped recruiting social care workers from Nigeria or not. And I'm sure you must have had one or two things because rumor travels fast. So let's clear it now. I'll start by sharing the NHS employers red list countries with you, so you see the countries that are on the red list. It is not only Nigeria. There are other countries on the red list. So we have Afghanistan. These are the countries: Congo, Cameroon. Where is Nigeria? Yes, this is Nigeria. This is Ghana. And Nigeria has been on the red list countries for a while. So this is not the first time that Nigeria will be on the NHS employers red list countries. Nigeria has been on the red list country for a while. So what did the UK government say about this? The 23rd of March 2023, the Department of Health and Social Care updated the Code of Practice for international recruitment of health and social care personnel in England. And this is the update. Let me read. We are pleased to introduce the revised Code of Practice for recruiting internationally for health and social care organizations in England. With the projected global shortage of 10 million health workers, to achieve universal health coverage in low and low middle income countries by 2030. So if you want to read the update, you can click on this. The link is in the description, so just click here and read more. But for the sake of this video, let's keep reading. We remain committed to be a force for good in the world and support better health and care both within and beyond our shores. That's interesting. We recognize the important role that the international health and care workers play in health and care service delivery in UK, and we are committed to ensuring that the recruitment from overseas we recruit from overseas in an ethically responsible manner. So how are they going to recruit in an ethically responsible manner? Because that is what they said. Health and social care organization in England do not actively recruit from those countries the World Health Organization, WHO, recognized as having the most pressing health and care workforce related challenges, unless there is a government-to-government agreement to support managed recruitment activities. Let me read this part again. Health and social care organization in England do not actively recruit from those countries the World Health Organization, WHO, recognized as having the most pressing health and care workforce related challenges, unless there is a government-to-government agreement to support managed recruitment activities. So this is the part that people have been misunderstanding. Let's keep reading. Through effective bilateral work such as our memorandums of understanding with the governments of India, Kenya, Malaysia, the Philippines. I'm just dumping, don't mind me. We are working in partnership to support well-managed migration pathway that deliver benefits to NHS, the health or care professionals, and the sending countries. So if you have time, you can read the remaining part, but let's go to definitions. What do they mean by active international recruitment? Because what they said is, health and social care organization in England do not actively recruit from those countries the World Health Organization recognized as having the most health and care workforce related challenges. So what does actively recruit or active recruitment, what does it mean? Let's go to the definition. You can see that we are still on UKGov page. Okay, so let's go to their definition. Active international recruitment. Active international recruitment in the code is defined as the process by which the UK health and social care employers, including local authorities, contracting bodies, recruitment organizations, agencies, collaborations, and subcontractors, target individuals to market. You see, to market UK employment opportunities with the intention of recruiting to a role in UK health or social care sector. It includes both physical or virtual targeting, or whether or not these actions lead to substantive employment. To market. This implies that agency cannot come to Nigeria to market that, oh, we are recruiting nurses or we are recruiting social care workers in the UK. They cannot market, they cannot advertise and target Nigerians. They cannot advertise and target Ghanaians, but they can advertise and target Indians. Are we on the same page? Do we understand? Because this is what is causing the misconception or the rumor or the misinformation here and there, and I want to clear this. Okay, so let's go to the other information are here. You can read it. The link is in the description. So click on the link and read more. But what does direct application, what does it mean? For the purpose of the code of practice, a direct application is when an individual makes an application directly on their own behalf to an employing organization. I repeat, for the purpose of this code of practice, a direct application is when an individual makes an application directly and on their own. Why did I keep repeating on their own? Directly and on their own behalf to an employing organization. This means you can do your application by yourself, directly and on your own behalf. So if you see an application online and you apply, that is a direct application that you do on your own behalf. That is a direct application, and it is not against the recruitment code. But the only thing against the recruitment code is that agency marketing or advertising a recruitment post and targeting those on the red list countries, because these countries are facing health and social care workers challenges. They don't even have enough in their countries. There's healthcare worker shortage in those countries. So it is not fair for them to go to those countries or target marketing at those countries. It is not fair. And that's why they said they are not going to do that. It is totally against WHO recommendation. And they said, okay, we're not going to do that. But if an individual apply on their own to a recruitment agency, then they are good to go. Are we on the same page? Okay. Direct application do not use a third party, such as recruitment organization, agency, or collaboration. Let me read that part again. Direct application do not use a third party, such as recruitment organization, agency, or collaboration. So if you're doing a direct application, it means you're not going through agency, you're not going through recruitment organizations, you're not going through collaboration. You know, there are agencies in the UK that recruit for the NHS and other private organizations. So as healthcare worker or as social care workers, if you want a job or if you want to get a job with visa sponsorship in the UK, you have to do it yourself. You cannot go through agency, recruitment organizations, or you can't go through collaboration. This is what the new code of practice entails. It doesn't mean that the UK government have stopped recruiting social care workers from Nigeria, Ghana, and other African countries. So if you've had this rumor and you've been panicking, it's time for you to drink cold water and relax. The UK government has not stopped recruiting health and social care workers from the countries or the red list countries. They've not stopped recruiting. But to get a job, you have to do a direct application. It has to be a direct application. You cannot go through agency, you can't go through collaboration, and you cannot go through recruitment organizations. So if you need more information, just click on the link, read more, understand, and don't be scared. The UK government has not stopped recruiting social care workers from the red list countries. All you need to do is a direct application. Go online, search for care homes or NHS job, those that are recruiting with tier 2 visa sponsorship if you need one, and do a direct application. That will be all for today. Thank you so much for watching. Please like, share, and subscribe. I say this all the time. Like this video. People are panicking. Let this information get to people that need it. Let them know that the UK government is still recruiting, but not actively recruiting from the red list countries. See you guys in my next video. Bye-bye. Bye.